you for joining our presentation on balance. Can anybody identify with this title? My balance is terrible. What can I do about it? Good balance means being able to control and maintain your body's position whether you're moving or still. Many of our different body systems, including muscles, bones, joints, eyes, inner ear, nerves, heart, and blood vessels, must be working well and working well together for us to have normal balance. When these systems aren't functioning well, you can experience balance problems. Many medical conditions can contribute to these problems, and unfortunately, we tend to have more of these conditions as we get older. You may have noticed that your balance isn't quite what it used to be, but you really aren't sure if you would be considered at fall risk. You can find out by taking 4 quick assessments to get a baseline. That's important because 1 out of 4 older adults falls every year, with almost 2/3 of those falls occurring indoors at home. So it's a great idea to get an objective look at where you're at so that you have time to do something about it. The Villages Health offers regular fall risk screenings free of charge throughout the various care centers, and you don't have to be a member to participate. If you'd like more information about dates, times, and locations, visit the Villages Health Learning Center webpage. Let me walk you through what to expect. The first assessment you'll be asked to do is a brief paper and pen test. It's a self-assessment in which you'll be asked 12 simple yes or no questions. Next, the 4-stage balance test will take a look at your ability to hold a series of 4 different positions while standing, each getting a little bit more challenging than the previous, with the goal of holding each for at least 10 seconds. The chair stand test will assess your lower body strength, and the timed up and go will take a look at your balance while you're walking. In the next set of slides, I'm going to list several conditions that may contribute to a change in balance. Inner ear conditions that contribute to loss in balance include Meniere's disease, benign positional paroxysmal vertigo, and inner ear inflammation. Unaddressed hearing loss can result in you not hearing something like a pet approaching until it's too late and you stumble over them. Our sense of vision contributes very heavily to balance, and if you don't believe me, next time you're standing up, make sure that you grab onto something for an anchor, but close your eyes for a little bit and notice how your balance changes. Most people will notice they begin to sway a little bit. Changes in depth perception and visual acuity affect our ability to judge distances, and changes in levels leading to trips and slips. Deterioration of brain cells in neurological diseases such as Alzheimer's and Parkinson's interferes with communication between nerves and muscles, resulting in changes in coordination and walking patterns. Neuropathy in the feet interferes with a person's ability to accurately sense the surface underneath them. And cardiovascular conditions such as TIAs or irregular heartbeats can cause dizziness by reducing the amount of blood flow that reaches the brain. And resulting weaknesses after a stroke also contribute to changes in balance. Both high or low blood sugar can trigger dizziness, and the same is true for high or low blood pressure. Remember, our definition of good balance means being able to control and maintain our body's position, whether moving or standing still. Arthritis causes pain that can result in us moving differently to favor that sore hip or knee. This new movement pattern, however, might put us in less stable positions. Not to mention that arthritis pain usually results in people giving up a lot of their physical activity to avoid the pain, which unfortunately leads to further physical deconditioning. Physical deconditioning means loss of muscle tone, reflexes, coordination, and changes in our center of gravity, all of which are leading precursors of falls. Loss of stamina also makes people tire out more easily and much more likely to fall. So what do we do? Before talking about possible solutions, I want to take a moment to provide an analogy and ask you a question. Problems with balance are like cracks in the foundation. Left unaddressed, they will likely lead to collapse. So my question to you is, are you willing to do what you need to do to stop it? If fall risk assessments indicate that you're at a high risk for falls, are you willing to A, get in shape if you're not currently, or B, use a walker or cane if needed? Tips and tools are only useful if they're used. Let's take a look. It's important to start with regular health screening. Have your blood pressure checked while lying and standing. Some older people have normal or increased blood pressure while seated, but their blood pressure drops too much on standing, and there's no way to know unless you check. Tell your doctor if you feel faint or unsteady when you get up from sitting or lying down. Get your vision and hearing checked regularly. Even small changes can compromise our body's ability to respond quickly and accurately to changes in our environment. Your doctor will create a care plan for you to address any of those problems identified in regular screenings. After you've been assessed by your healthcare professional, they may recommend seeing a specialist depending on the suspected source of the balance problem. For example, if you're having a joint problem, you would go to perhaps an orthopedist, or if you're having problems with your heart, you would follow up with a cardiologist. As you can see from looking at this list, some of the most commonly prescribed medications can affect balance. Sometimes the problem isn't a single drug, but the combination of medications being taken together. Older adults are even more vulnerable because drugs are absorbed and broken down differently as they age. If you're concerned about how your medications might be affecting balance, you can contact your doctor or your pharmacist to review the drugs you're taking. Remember, it's never a good idea to stop taking something without first checking with your healthcare provider. Just because you could wear certain shoes before doesn't mean you can still do so safely. If your balance has changed for reasons we've previously discussed, it's important to take a look at what you're currently wearing on your feet and maybe purchase some more sensible or stable footwear. Next time you enter your home, pretend you're a fall risk inspector, looking for anything that might cause a fall or anything that you could do to prevent a fall. If you've lived in your home for a long time, you may have to now make some adjustments to accommodate changes in your balance or your loved ones. The CDC has a great home fall prevention checklist that can help you identify things that put you at fall risk that you might not have thought of. It's important to have adequate strength, flexibility, coordination, and reflexes to go about your day safely doing all the things you love to do. As we age, we lose those abilities if we're not physically active. So it's very important to remain physically active, because if you're not, you're losing in all those areas. Dehydration can trigger low blood pressure, causing dizziness, as well as lead changes in inner ear fluid volume and pressure. So be sure to stay hydrated and plan ahead to bring water if you know you'll be out in the heat. Addressing medication usage, updating hearing aids and prescription glasses, using proper footwear, making home modifications, and getting in better shape, as just discussed, will all help with better balance. However, certain diagnoses or changes to your body may require you to use some extra help once in a while. It's important to use some form of assistive device when needed. You may not have to use it all the time, but perhaps just in busy, crowded places like airports, or places that will require either a lot of walking or you're going to be surrounded by other people that could bump into you. There are great technological advances in terms of walkers, canes, and walking poles. Athletic poles are a great way to keep you active and walking if you're starting to feel unsteady. At the end of the day, it's important to be realistic. Ask yourself, should I be doing this? Or do I need to adjust my expectations? For example, I'd love to take my grandkids to Disney World, but should I be walking around all day? Maybe I should just bring my cane because it's going to be a longer day and I will want to stay longer. Do I know which exercises are best for me, or should I take a class? If you're not currently exercising and have been told by your doctor that you're at fall risk, a great program to consider is the Matter of Balance. It's a free 8-week course offered through the Villages Health that will help you identify what you can do to improve your balance and teach you a simple balance focus exercise routine that you can do at home. Most participants have noticed positive changes in their balance at the end of the class if they commit to doing these exercises daily. Also ask, do I need to delegate some physical tasks that I used to do on a regular basis like yard work or house cleaning if I'm unsteady? These are tough things to consider, and that's why I chose the picture that I did on this slide. These are humbling things, but if you're willing to make the adjustments at the right time, you'll be able to maintain balance, not fall, and continue to have your independence a lot longer. We hope you found this presentation useful, and thank you for listening in.